tract symptoms. Good afternoon, experts, ladies and gentlemen. And I'm from Kaohsiung, Taiwan. I'm majoring in women's urology. So my topic is about the effect of HIFU surgery on the urinary tract. So my topic is a little bit different from the others. So we have 17 HIFU equipment in Taiwan. This is the data before April. So in Kaohsiung, in these areas, as you may see from this map, these different hospitals here in Kaohsiung, we have HIFU treatment system. So it's an important place for HIFU. And urinary myomas are the most common benign pelvic tumors, affecting 25 to 30% of women during their genital active period. So some of the clinical symptoms that are seriously affecting the quality of the patient's life, like menorrhagia, dysmenorrhea, dysrhythmia, or lower urinary tract symptoms like urgency, frequency, or incomplete bladder emptying, urinary incontinence, and very common symptom, and also the adjacent organ compression for bladder and bowel. And with the location in cervical area will cause the infertility. And LUTs are commonly linked with pelvic pressure and defectionary symptoms in women with uterine fibroids. So we call that bulk symptom. And these symptoms are termed bulk symptoms with a reported prevalence of 75% in women with fibroids. And larger fibroids and anterior fibroids location of the dominant fibroids have even been shown to be correlated with more severe urinary symptoms. And this paper talks about the location of the myoma, relation with the urological complication. So leiomyoma can lead to urological complication depending on its logical of growth. So growing capillary compression on the ureter. Compression of the leiomyoma anteriorly and inferiority over bladder, causing urethral and obstructive symptoms. And this can interfere with storage and emptying of the bladder, cause the urgency and frequency. So different locations with different symptoms. And this paper is about the lower urinary tract systems in patients with uterine fibroids, association with fibroid location and uterine volume. So through this questionnaire, Bristol questionnaire, cross-sectional study including 78 women seeking surgical treatment for symptomatic uterine fibroids. And with different fibroids of urinary incontinence and urinary urgency and frequency. And this is another paper of the larger volume of the fibroids may cause the urinary urgency. Because larger uterine may cause the compression to the bladder or may cause the systematic metricity. According to statistics, the anterior location myoma with a larger myoma will comparatively cause the urinary incontinence or incomplete bladder emptying and a compression in the neck and cause some symptoms. And as I mentioned, the uterine fibroids impact on the urinary system, and also about the adenomyosis and urinary system symptoms. So the compression effect is the main symptom or indications. And because of the compression of the bladder, and this paper is about the 108 individuals, including 50 patients with adenomyosis and 58 controllers were included. And 80 cases with the symptoms according to the obese scale. And compared to the control group, 50% of the control group. So it had tend to have the OB symptom. And urinary frequency or urgency is in this group is higher than the other one. So in the adenomyosis group, these symptoms are commonly seen. And also causes of the urinary urgency. So it's called the evil twins. It's called the ICO-BPS. So with the endometriosis, will tend to have the endometriosis. Patients with ICO-BPS will have this pain or have this urinary urgency, probably 15 minutes. So that might be caused by this ICO-BPS syndrome. According to the magazine's paper, it's about the ectopic endometriosis in the pelvic cavity evokes bladder hypersensitivity via transient receptor potential occurring. One, hyperexpression in rats. So it's called PRPA1 for short. So there's expression in the mucosal membrane of the bladder was significantly higher in endo group than in the Shem group. So the pathophysiology between LUTS and adenomyosis can be seen from the following slides. And there are some suggestions about the cause of more frequent LUTS in patients with adenomyosis. So with the compression effects, not that strong as the adenomyoma, but mild compression will cause the decrease of the bladder volume. Another one is that the enlarged uterine volumes can also increase because of the releasing hormones. So all these may cause the effect to the urinary system and cause the compression symptoms. And the patients with lots and their uterine might be a little bit abnormal. So the urinary symptom caused by myoma is similar but not totally resemble. And this is the effect of laparoscopic hysterectomy on bladder neck and urinary symptoms. And after the resection of the uterine and the symptoms 6 months, half a year later, might be improved. So the removal of the uterine will have some positive effects on the symptoms of LUTS. And also the bladder neck. The movement of the bladder neck, and according to the scales, it can be improved a little bit. But it is for short term. We don't know about the data for a longer term. So in the 500 cases of high-intensity focused ultrasound ablated uterine fibroids and adenomyosis. So there are some statistics for this. These patients, there are some improvements of their symptom of dysmenorrhea. And also ICIQ and the questionnaire on their life quality. And we can see from this questionnaire, these situations have been improved. So in general, the uterine fibroids after HIFU surgery, there are some help for these patients in terms of urinary symptoms. So according to these statistics, so we would like to evaluate the effects and therapeutic effects of ultrasound-guided high-intensity therapy of uterine fibroids on LUTS, as well as the clinical effects after HIFU therapy. So from the year 2015 to 2019, 75 patients suffer from symptomatic uterine fibroids. So we have this objective assessment and subjective assessment of the volume of the uterine or the volume change of the uterus and uterine fibrillation. And the questionnaire we adopted, OABSS, overactive bladder symptom score, and the urinary distress index, UD6 or IQ7 incontinence impact questionnaire, and ICIQ is the International Consultation on Incontinence questionnaire, and a female sexual function index, FSFI. And through this questionnaire, we get the evaluation data. So among these 75 cases, 6% of the multiple fibroids. And the types of fibroids that you may see from these slides, and the location of the fibroids, the anterior wall 60%, and not anterior wall 40%, and the size of the uterus with the weight of over 600 grams, and the sonication power total treat time 2 hours. So after HIFU treatment, so 3 months, we can see from the OABSS there are some improvements. And so OABSS is the overactive bladder symptom score created by Japanese professor. So with the different scores for different levels of the activity of bladder symptom. So the 6 mild, 12 means very severe. And UDI 6 so we have already have the Chinese version of a UDI 6 and IIQ 7. This is the Chinese version. This is the scale, as you may see in Chinese, the seven items. And ISIQ questionnaire is very brief. Some main questions about your urinary symptoms and the frequency or the amount or the severity of the symptoms. And this is the changes in scores of sexual function, FSFI, which is very famous to scale the female sexual function, including the desire, arousal, lubrication, and orgasm, and different improvement in different areas. So also with the pains and satisfaction, and no statistical significance because insufficient samples. And according to the data from OABSS scores, the larger the uterine and more tendency to OAB. And the volume, the larger of the volume of the uterine, and intend to have OAB. But the location is not necessarily closely related to OAB. For the ones with a larger uterine, after the HIFU operation, and there will be some obvious improvement. Because the non-anterior proportion is higher. So there are some statistical significance for that one. And let's check the sexual function. The women with uterine fibroids will have less desirable sexual function. So, because it may cause the sexual pain symptoms. So, volume over 200 grams will cause some disfactory scores. So, FSFI score will be improved after the resection of the uterine. So after the HIFU surgery, and there was some improvement of the overall quality of sexual life and other indicators. So generally speaking, the whole general situation of the trend will toward to improve. And the conclusion is that we know the lot symptoms. So, we will see some successful ablation and shrinkage of the uterine fibroid size alleviates the bothersome lot symptoms. Adenomyosis caused the lot symptoms, and the causes are varied. And we can see that from these data, from these slides. Apart from the compression effect, adenomyotic tissues are express inflammatory and neurogenic factors. So after the HIFU surgery and to ablate the myoma, and many of these symptoms will be relieved. So the effects are different. So HIFU's effect on improve the LOTS symptoms is fairly obvious. So LOTS severity was correlated with the uterine volume, length, and location of the fibroids, and had a limited effect. So the location of the myoma of the LOTS is not that obvious. And this is the picture taken this year in May, and we have reached 1,000 cases of HIFU surgery in our hospital.